Medical Notepad, brought to you by Cardiovascular Systems Incorporated's Patient Advocacy Campaign, Take a Stand Against Amputation, and The Weight of My Heart.
My name is Marco Manzi. I'm an interventional radiologist, and I'm involved since 1998 in treatment of PAD. So this week for Medical Notepad, I'm going to talk about vessel preparation. Why vessel preparation? Because we discovered in the last at least 5 years that preparing the vessel results crucial in the acute outcome and midterm outcome of our procedure of revascularization. Of course, we are speaking of endovascular revascularization. We can prepare the vessel for stenting, for angioplasty, for drug elution. So I mean the use of drug-eluting balloons, for example, but even for a simple angioplasty. What does it mean, prepare the vessel? If we have an occluded vessel, and we are speaking of a vessel of the leg, of course, but when we decide to reopen, recanalize this vessel, we have to take into account the amount of calcium we have in this vessel, and we have to try to, in a gallery, to create a space, to recreate the space of the channel of these pipes from the top of the occlusion to the end. So we can inflate the balloon simply trying to move side by side the material we have inside, or we can try to remove the material. To remove the material, we may try to use what we call the atherectomy device. The atherectomy device, of course, could be rotational, directional, orbital. The mechanism is always the same, remove the material, or we can try to crack the calcium to create microfracture in the plaques through the microfractures, or with less calcium, less material inside, we can inflate the balloon. On the balloon, there is a drug, there is we call medicated. So there is a medication. This drug can pass from the balloon into the vessel layer, internal layer, in order to reduce the possibility to have an hyperplasia, a reactive hyperplasia from the vessel that in the future may recreate a restenotic lesion or reocclusion in that area. This vessel preparation permit to receive a balloon with low pressure, so with no fracture of the vessel or detachment of one layer or more layers in the vessel. And we don't want this. There is a difference between the use of a atherectomy device, which is not painful at all, compared to high pressure angioplasty. High pressure means up to 30 atmospheres. If we think we inflate the tires of a car is 2.5 atmospheres in the front and 3 in the back, we use 30 atmospheres. So 30 atmospheres is a very huge pressure and could be very painful for the patient. So that's why a proper use of this device, a proper use of the vessel preparation, so less pressure, and we permit the drug arrive into the internal part of the vessel, and we can prolong the patency of that vessel. Of course, every vessel preparation procedure needs more time than a normal angioplasty. We have to invest time, we have to spend time in order to have better results in the future. So This is Medical Notepad. This is Dr. Bartolanzi.
Remember, the advice and views offered during this series are for informational and educational purposes only. Always ask your own healthcare provider for explicit consent before acting on any information provided here. If you want more information on peripheral artery disease, go to standagainstamputation.com. And for real-time support, go to thewaytomyheart.org.